advice from somebody who can provide a more comprehensive approach to it. Greg, may you want to add to that?
Oh, no, I think that's a good response, certainly. But I mean, I would be suspicious of any advice that recommends one single food or a food group for that matter. One of the most important dietary recommendations is to consume a wide variety of nutritious foods, and that applies to everyone, including people with diabetes or cardiovascular disease.
Okay. Well, we were talking about prevention. Let's go back to that.
We're still talking about prevention, and in terms of calling these lifestyle diseases, I've been in very many functions where when we begin to talk about non-communicable diseases, somebody says it's the disease for the rich. And increasingly we are saying it's not a disease for the rich. Sometimes people say it's a disease for the West. However, the statistics currently show that although the burden is higher in the West, a lot of the mortality, a lot of the deaths really occur in low and middle income country. We were just talking with Greg before we came on air that the recently concluded United Nations high-level meeting on non-communicable diseases in New York in September this year was really focusing on how to prevent the rising tide of NCDs in low and middle income countries. So it is an emerging problem here, and the window we have, as opposed to the other countries in the West, is prevention. That we can do something to prevent these diseases from becoming a major epidemic in our context. And prevention means looking at what are the risk factors. When we started this show, we talked about the 4 key risk factors. This is tobacco, unhealthy diets, lack of physical activity, and harmful use of alcohol. These are the 4 main ones. In Kenya and in other African countries, we've also added infectious diseases, that if somebody has HIV, or if you're living with HIV, you then are at higher risk of getting also some of these conditions, including diabetes, cancers. You are at higher risk of those infections. So we've also looked at what's the role of infectious diseases in increasing your risk to non-communicable diseases. But what we are saying is that it's no longer a disease of the West. These conditions are with us. It's no longer a condition for urban people, the rich people. It is also affecting the poor. What can we do? How are we addressing tobacco? Tobacco use is not a problem of only the wealthy people. It's also a problem of everybody in this country, the poor, the rich. What the young man asked initially was, what can the youth do? What can the youth can do is to begin to create awareness about the risk factors. The youth have a big role to play. In fact, in some of our work, the work we're doing around research and on primary prevention, we're really focusing on the children. If we can begin to change the attitude, the behavior of young children, we then have a population that is growing up with higher levels of awareness, that they know the risks. Some of us, when we were younger, maybe nobody really talked to us about tobacco use. It was fashionable to smoke. But can we tell young people that it's not fashionable? It is a risk. So if we begin to educate young children, we begin to tell children that crisps are okay, but if you don't eat them every day. I was doing a sensitization in school, and they said, are you telling me KFC is bad? I should never eat KFC. And I'm thinking, I'm not saying you should never eat KFC. Once in a while, KFC is okay. But if it becomes a KFC day every day, then you are increasing your risk of developing these diseases as you grow older. What also Greg talked about initially is for people who are children who are undernourished. As children, you are really stunted, you really are undernourished. We are seeing a changing in trend. When you become an adolescent and you have access to food, then your propensity to become obese is higher. So we are saying even then, addressing nutrition of children, both the underweight and the overweight, it's a critical challenge for this country. And we need to address both. that the risks are higher even for that child who was undernourished. When they get into teenagehood, you see the levels of overweight and obesity increasing. But essentially, when we talk about overweight, and I think this is one thing that we need to go back to, we talk about body mass index. And sometimes people say that's a Muzungu measure. Body mass index is just mean you are heavier than you're supposed to be, and a lot of us are. We also look at the waist circumference. If you measure your waist, there are measurements that put you within normal and put you within the overweight, obese levels. So if you see somebody with a distended waistline, it may look, it may be culturally unaangaliwa vizuri. For those who understand Kiswahili, you live a good life, but it's a risk factor. So when we talk about body mass index and we talk about the waist and hip circumferences, we're basically saying that your levels of risk are higher and you need to do something as an individual to begin to reduce it. So there are individual actions we are talking about, but again, when you talk about prevention, we're really looking at what the population can do to change the future of this epidemic that we know is certain. And as we become highly urbanized, we really are aware that we as a country, we are still grappling with communicable diseases. We should not be exposing our people to the risk of non-communicable diseases, and yet the risks are here.
Okay. Well, Greg, what intervention opportunities do we have currently?
In Kenya and the rest of Africa.
Yeah.
I was referring earlier to the low-cost solutions that are available to governments, and I guess one important thing to mention here is that the health minister cannot do this alone. The health professionals cannot do this alone. It really does require a whole-of-government approach. Ministries of Finance, Agriculture, Trade, Commerce, they all need to take a role in preventing non-communicable diseases, because this is not just something that health professionals can handle on their own. I was speaking specifically about tobacco control or the reduction of tobacco use earlier, and some of the interventions that are required there. They obviously require the support of the whole of government. I was specifically talking about tobacco taxation, which requires understanding from the Ministries of Finance. Mm-hmm. And they can take a lot of benefit from the revenue that may be gained by increasing tobacco taxes. So that's tobacco control. Similar efforts can be made in the regulation of alcohol and food. And what we're trying to do here is not reduce people's choices, but improve their choices by making the healthier products more available, more affordable, more accessible, not to completely remove the other choices, but to improve the profile of the food supply, the alcohol, and yes, we need to, there's no safe level of tobacco use at all. So we also mentioned earlier physical activity. With increased urbanisation, things can be done to make neighbourhoods more easier to be outside and to be moving around from place to place without the use of cars and buses all the time. So and the use of bicycles. So getting kids out, but also adults out being more active, requires changes in the way we plan the urban environment and plan neighbourhoods to make it easier and safer for people to be active.
Okay. Well, there's a forum tomorrow. Mary, tell us a bit about the forum.
The African Institute for Health and Development, together with the Non-Communicable Diseases Alliance for Kenya, which brings together many associations, including the Kenya Cardiac Society, Diabetes Management Information associations, and other professionals working on NCD-related activities, are holding an open forum And this forum will be looking at the research needs and the capacity building needs. We've talked about access to health professionals. We've talked about the need for screening. We're really emphasizing the need to understand what are the risk factors and what can be done locally, what low-cost solutions can be put in place to be to help in prevention of exposure to the risk factors that are responsible for a lot of the non-communicable diseases. The forum will be held at the Crown Plaza Hotel in Upper Hill. It will be, the official opening will be done by the PS responsible for National Council for Science and Technology. It brings together people from Kenya, experts from Kenya, but also experts from the region. We have representatives from Ghana, South Africa, Nigeria, and other countries that are all grappling with understanding the local context and the regional context of non-communicable diseases in the country, in our region and in our countries. We also would be disseminating information on the United Nations High-Level Summit. We'll also be talking about what we are doing in Kenya, what are our population-level interventions, and what individuals and institutions and communities need to do to prevent non-communicable diseases. Prevention definitely is the message we are sending out, and the fact that knowledge and culture, I will not finish, I'm an anthropologist. It's important to look at the role of culture, what we consider healthy, who we consider a health person, who we consider a wealthy person, and all things about how we look at people and how we stereotype people are important. That if you are fat, you are healthier, you are wealthier. I think that's something that we need to be changing. That if people see you walking, it's not a good sign. It's good to walk. It's physical activity. So even just talking about our own attitude as individuals and as society and as Kenyans and as Africans is something that we really, as an institution and as partners in this, need to worry about. Greg mentioned something important, that Minister of Health will not do it. If we want to change the way people live in Nairobi, if we want to increase walking to work, we really have to work with the City Council. We have to work with the Ministry of Transport. We have to work with the people in roads. We have to also ensure there's security for the people walking. So it is a whole of a multi-sectoral approach, bringing different people around the table and saying, how can we make it safe and accessible and easy for people to walk? How can we market our products? How can we ensure that Ministry of Trade is around the table? So it's not a Ministry of Health initiative alone. It's not a burden for one sector. It's a burden for all the sectors of development. And we'd really want to encourage people to begin to think about the health of Kenyans in the next 30 years. What do we want to see as a healthy Kenya as we move forward?
Well, thank you very much for coming.
Thank you.
Today's topic was on non-communicable diseases, and definitely what Mary and Greg are saying there is we need to take care of ourselves better. Especially when it comes to what we consume. Let's watch out on how much we consume and what kind of foods we're consuming. And of course, much more. Talk about tobacco. We need to consider how much we consume tobacco. There's so much more. I'm sure most of you and each of you who was watching today's interview has learned. Let's also take that information and use it in our daily lives. Thank you for watching the Big Issue segment. My name is Leah Ngari. Keep it K24.